everyone. Welcome to this episode of Compliance Deconstructed. We have a truly fascinating and interesting episode in front of us. But before we get there, I'm your host, Jessica Zeff, and joined by your other hosts, Lorie Davis and Elvan Baker. Just a bit of a warning for those who are looking at us on a screen. We're having some technical difficulties this morning. The winter is not cooperating. Just bear with us. Elvan is certainly here contributing to the conversation, but we're just not going to get to see her beautiful face today. But we'll put that on for next time.
Like I said, so much for my makeup, time spent this morning. Oh, well, everyone. The valuable one here today is Lorie, so I'm happy. I'm happy.
Oh my God. These two are cruising for a bruising, as my dad used to say. Just saying, that's the kind of episode you're in for today. But we are going to talk about the wonderful world of Medicaid. It's an area where there's a lot of misunderstanding, not a lot of knowledge around the regulatory Medicaid space. So the three of us thought it would be a good idea to combine our experiences, share our experiences and our knowledge in that space. So with that said, let's get to it. So when we talk about Medicaid, first things first, to get us back to a shared understanding of what we're talking about. Lorie, do you mind explaining what Medicaid is and what it's known by sometimes?
Yeah, absolutely. So when folks think about Medicaid, they should be thinking about a joint partnership between the federal government and state governments that provides primarily physical health, sometimes vision, dental benefits to folks with low or limited income. And that includes children, pregnant individuals, seniors, folks with disabilities. Eligibility is almost entirely income and category based. To compare that, many people know Medicare. Medicare is all federal, primarily for folks that are 65 and older, and some folks with disabilities or end stage renal disease. Eligibility is typically age or disability status and not income. And then for most folks who have a job or have commercial insurance, that's considered private coverage, typically through an employer, or you can purchase it individually. Benefits, cost sharing, eligibility vary by plan, not tied to income, not tied to any sort of age or disability. So key differences will typically include who qualifies, how the programs are funded, and the scope of benefits, and of course, that cost share, how much you'll pay out of pocket. So, what is it called? It can be called Medicaid. It can be called medical assistance. In California, it's called Med-Cal. In Massachusetts, it can be called Mass Health. In Pennsylvania, it's called Health Choices. In North Carolina, it's just called North Carolina Medicaid. In Wisconsin, it's called Badger Care. And so your state may have a fancy title for it, or it may just be called Medicaid. So your results may vary across the states and territories. So
What's it called
hopefully
in
I've set the stage.
Pennsylvania? What's it
Health
called?
choices.
That is. Now,
Health choices.
and that's for those of you who think you know it all. That's really just to level set and make sure we're all understanding what these different programs are. This is important because each of those programs, whether it's Medicaid or Medicare or private healthcare insurance, they come with different rules and regulations. And Medicaid is really very specific. Medicaid is really quite unique. Why is that, Lorie? I mean, what's going on with Medicaid? Is it one program across the country?
No.
Okay.
No. It
So
is
if I have
absolutely different.
experience, you and I have a lot of experience in Medicaid, Pennsylvania, West Virginia, Delaware.
Yep.
I'm in California. I'm in other states as well. So what's going on there?
Yeah. So each state also has kind of their own income level that gets an assessment. And so the federal portion, and I hate to use a lot of acronyms, so I apologize, but there's a federal share for Medicaid that's called the Federal Medical Assistance Percentage, or FMAP. That gets dispersed out across the states based on their income levels. That is also called the federal poverty level, or FPL. So each state will get a percentage. They aim for 50-50, but some states may have 60, some states may have 40, but it's always right around that 50-50. And then the states in turn will decide what benefits they're going to cover, if they're going to work with any managed care entities, how that will work, what are the eligibility thresholds, the AKA the income threshold, how will they get the services out, and then how will providers be reimbursed. And it's definitely not the same across every state. Does that make sense?
Yeah. So what I'd like to, we have a wonderful inside joke, and Lori's great at the delivery, and I'm going to ask her to repeat it because I'm not nearly as good.
Oh,
If you know Pennsylvania Medicaid, you only know Pennsylvania Medicaid.
yes,
So,
yes, yes.
and the
That is
same with,
very
go
different
for
than
it. Can you say
commercial
it,
or
Lori?
Medicare.
Can you say it? Because I love the way you say it. You say it with such energy.
No, I mean, you more or less said it the way I say it. If you know Medicaid and you know Pennsylvania Medicaid, well, you know Pennsylvania Medicaid. There's still 49 states and territories that have their own way of administering Medicaid. And sometimes things are carved in and carved out. And what I mean by that is in some states, for example, there may be pharmacy benefit where if you need a prescription or something like that, where that could be administered by the state instead of by a managed care entity. And so states really can pick and choose how they administer the benefits and what is not covered. And again, you just need to look at your state, because I can tell you about certain states, but then you could say, well, I live in, some other state, and I could say, well, I don't know. Another thing that can be carved in or carved out are behavioral health services, mental health services. And another one is long-term services and supports. So those members that really need care, we know will always need care, and they've got a medical or a mental condition that prevents them from trying to go get a full-time job, or maybe they're permanently bedridden, that sort of thing. They're very in a critical care condition. So those services could be carved in or carved out. The other thing that I want to kind of distinguish from is the fact that if the states manage the Medicaid benefit entirely, it is typically called something like fee for service, or it's a direct plan. Whereas if you've got a managed care plan, meaning that you're working with another entity aside from the state to get your health care benefits or your vision, dental, that is typically very different than if the state does all the reimbursement.
And Elvan, I mean, pitch in here, but I think this is
What I
fascinating, and
want
I
to
think
ask is, yes, each state manages it on their own, but there is or is there an umbrella of safeguards at the federal level that creates either the template? So can you please go into that a little bit? Because I
Absolutely.
don't want the listeners to think about, okay, every state gets to do whatever they want, and then people go into political ideas. It gets a little too loosey goosey.
Yeah, no, that is a great question. So all of this is monitored under the federal umbrella of CMS, and that's the Centers for Medicare. I'm going to say Medicaid first, but they will say Medicare and Medicaid services. And when I say that, that also includes Children's Health Insurance Program, or CHIP. So all of that is managed under that federal umbrella, and there are a set of protocols. We have talked about them previously, called external quality review. or ECRO that really kind of governs how things get monitored. And then you start getting into things like program integrity, fraud, waste, and abuse, all of that. But it is subject to these protocols to make sure that, for the most part, even though there is some variance on what is carved in, what's carved out, how the states administer the benefit, but they are governed by those protocols. One other thing that I would be remiss if I didn't mention is that while there are standard protocols, CMS allows states to apply for what they call waivers, where you can try to have additional benefits or additional plan benefits that you offer to your members. And so, examples of that is there is one called a 1915 that's all about managed care. So if a state wants managed care plans to administer their benefits, they have to apply for that waiver. There's a different one that is for home and community-based services. So for example, if you're going to have a visiting nurse or a home health care worker, that's kind of governed like that. Any of the government community programs, if you're going into a community center or you're partnering with an entity, and I'm going to make up one like United Way or Boys and Girls Club of America, those sorts of things, you have to apply for a waiver. And then there's a generic waiver called an 1115 waiver, which is, hey, we have an idea for a program, but it doesn't fit into any of these others, but we'd like to explore it. And some really great programs have been launched through those 1115 waivers. In particular, I think about substance use disorder treatment or early treatment for mothers to make sure they're getting all their prenatal care, those sorts of initiatives. Those can be covered under waivers. Elvan, does that help answer your question?
It absolutely does. Yeah, it really does. So let's say another question, along the same lines. Do the states pull funding from the federal government for this at all?
Well, they do, but like I said, every state will be a little different.
Got it.
So in theory, it's supposed to start at like 50-50, but
Mm-hmm.
given the income level of certain states, that percentage could fluctuate upward or downward. And from
Gotcha.
there, each state has to kind of carve money out of their state budget towards the Medicaid and CHIP program. And if their state has affordable health care and they have a marketplace, which is
Mm-hmm.
covered under what they call Medicaid expansion, that will also be there is also a somewhat of a state component to that as well.
Got it.
So, ladies, then I'm really fascinated by this idea of difference, and I want to dig into that a bit more deeply and look at it not just by setting the scene of what the Medicaid space looks like, but really starting to look at it from an angle, from a regulatory perspective, and what that means for us as compliance officers and compliance professionals. And why am I saying that? So, we've been working in the Medicaid space for really at least a good percentage of our careers, right? And through, I've started off in the Medicaid space and through simply compliance in my work running the business. I mean, I've had the opportunity of working with really states all across the country and their Medicaid programs. And I have to say, it's been an absolute eye opener. Like when we tell you that no two Medicaid programs are alike, they're not alike. The way that they're structured, the way that they enroll providers, the way that they manage their Medicaid programs, actually, in some ways, from my perspective, I have clients that want to work in Medicaid across the country, right? And trying to get into, as a provider, a Medicaid program when all the Medicaid programs for states are very different is actually very frustrating. And there are a lot of reasons for this, right? So, a lot of the states, because they run Medicaid differently, they structure it differently, they may also have, different carve outs, different waiver programs. They might have different requirements for credentialing and enrollment as a provider. And I'm also going to say I have found through experience, and this is important for compliance professionals to know so that they can manage expectations and manage messaging, and so that they know a little bit more about what to expect. Getting involved in a Medicaid program, certainly as a provider, is not an easy thing. It's not for the faint-hearted. I have learned some states have more information than others on their websites. Some states, the information available about how to register is very complicated or it doesn't exist. And getting assistance isn't actually very easy. The states have varying resources, levels of resources to actually help answer questions or guidance through the Medicaid enrollment process for their state. It can be difficult to find out who's actually managing individual programs. Like some states, as a provider, you can register directly with their state Medicaid program as a Medicaid provider. You have to get through the enrollment process, and that looks different for every single state. Some require you to get fingerprints, some don't. Some require you to declare any investment interests in your organization, some don't. It's very, I think, very strange. I find it frustrating, but
So,
and
and
different.
on that
Oop,
note, Jessica, one thing I want to make sure is that we're kind of talking about from the standpoint of, if you're in Medicaid, if you would like to apply to be a managed care entity or you want to participate in Medicaid, you have to really start at the state law level because every state is a little different. Some require a request for application where you just throw in all your information, and then as long as you check all the boxes, you're good. Whereas some, because they're concerned about having too many providers or too many MCOs, they actually go for more like a request for bid process where you have to compete and it's a competitive bid process. So before we even get to trying to find all the information, and maybe you're trying to do that because you want to enter a market. You mentioned a client that was interested in getting into Medicaid. You really need to look across the spectrum at how you get in there because your results, again, will vary from state to state. It's not all the same. And yes, I agree with you that from time to time, the state information, while CMS will dictate some information that has to be out there, not all of it. And there are a few states that even put some of their information behind a paywall. And that makes it
yeah.
even more complicated and difficult to obtain if you're trying to just be educated and informed about the requirements.
No, that's really helpful. I mean, we forget, I think, because we've been working together and we know this space. The truth is, we're representing so much experience in this room. We've got the angle around managed care and health plans. We got the angle around providers. We got the angle of regulatory experience. Like, we've got so much going on in this conversation. It's actually hard, I think, to narrow it down. We're kind of going in different directions here, but your point is very right. And what that regulatory experience looks like can vary depending on the kinds of entity that you are. If you're a health plan trying to get into the Medicaid space, if you're a healthcare provider or a vendor trying to get into that space, your experience will vary, and it will vary state by state. And some states will offer services and be willing to pay for services that others don't. And the thing I find really interesting actually is interesting to know, like sometimes it's hard to know even where to get started. And I want to go back to what Lorie just said about understanding the law. The truth is, I owe a lot to Lorie, truth, on Medicaid. Yes, quit shaking your head. It's the truth. She gets embarrassed, but she is an expert in her field. I've learned a lot from Lorie about the Medicaid space. And one of the things she taught me early on is, as a compliance professional, how do you start to get your head around what is going on in your state for Medicaid? And I think it's really worth exploring. She's a great teacher. And one of the things, Lorie, that you taught me early on is to see if you can find, a copy of a contract or a draft contract. What are the Medicaid requirements? Whether you're a healthcare provider or you're an insurance company looking to get into the Medicaid space, how do you start to get a sense of what's going on? I mean, obviously, there's a bit of doing your homework and researching and using Mr. and Mrs. Google for a little bit of help, and your, any magazines, your industry, resources, right? So that's a good starting point. But your best starting point is to go back to the rules and regulations around Medicaid in your state and doing that homework and trying to find like a contract or agreement. Is that the right word, Lorie? But something that really spells out that
Yeah.
state's expectations.
Yeah. Yeah. In most states, I think it's called an agreement. It could be a contract, but you want to try and get the most comprehensive because there could be appendices or exhibits that are attached. So I'll pick on Pennsylvania. So Pennsylvania has a base agreement, and you could read that and, oh, that's really interesting, but it may not go into all the details. And then you get to the exhibits and you're like, whoa, wait a minute, that wasn't in the agreement. And then a lot of the financial information are understandably kind of protected as appendices. And that's not necessarily information that the public necessarily needs to know what the financial details are in every case. So sometimes those are understandably firewalled or protected. But I think the general requirements, hey, if I have a call center, it has to be open Monday through Friday. It has to be open from 8 a.m. to 6 p.m. Eastern time. I have to be open every other weekend, whatever the requirements are, right? Like I'm making some up. But if I'm thinking about joining as an MCO, I need to think about that in terms of my staffing, when I'm hiring folks. What are the required positions I'm going to have to have? Do I need to have a compliance officer, or can I just have anybody? Do I have to have a medical director? Do I have to have a licensed quality person? All of those things that you need to think about before you get in. And that's where you need compliance and, maybe your friends in legal to help interpret things and make sure that you understand what you're getting into. And then once you're in the market, you need those same folks to keep you, as Elvan would say, out of the pretty orange jumpsuits, to make sure that you're staying on the right side. And that will help you prepare for external audits and things of that nature as well. Really understanding and knowing that contract. But in addition, I would say your business owners should understand their requirements under that agreement. They need to know, hey, I work in appeals and grievance. My timeframes for responses is X number of days to make sure that I respond to that appeal, that grievance. Hey, marketing. Oh, I have to put out a member newsletter every 3 months. Oh, I need to know that. It's not enough for just compliance or just legal or just the executive team to know it. The business owners doing the work need to know what they're required to do to best serve the members that they're serving.
So I want to unpick that just a little bit more, because there's a lot
When you're
to
done unpicking
unpack.
that one, I have to unpick some. I need to unpack another part. Once you're done unpacking that, poor
I
Lorie
told you guys it
today.
would be exciting.
Fantastic.
I
This
know.
is like a lesson. I know. We're taking
It's
ourselves to class
wonderful.
today. Fantastic.
It's so nice somebody cares about Medicaid
Oh,
because
of
Lorie.
course. Are you
Um,
kidding? But there's so much to unpack there. And what I'm interested in is the how, right? So whether you're an insurance plan wanting to go into the Medicaid space, or where you're a provider that wants to enroll and offer Medicaid services, there's an element of understanding those contracts and what Medicaid requires of you within that state. So it really doesn't matter what kind of entrant you are into the Medicaid space. There's an element of really understanding what you're getting into. So I'd like to talk about, well, but what does that really mean? And so what from my perspective, It means a level of analysis. You're getting your compliance professionals to come in, look at these requirements, and start to unpick the requirements. So for me, and this won't work for everyone, right? For me, it's really about, well, reading those contracts and the appendices and any associated documentation, maybe making a spreadsheet, and your spreadsheet will probably be huge, maybe even multiple tabs, but you've got to have a way of pulling out the requirements and understanding what the organization is, how they're going to have to be structured, what rules and regulations will apply. What does that mean? You've got to have some sort of tool or process for picking apart those requirements and being able to identify what business owners will need to be involved where, what will we need to build and develop. So it's not as easy as saying, oh, okay, we need a complaints team or appeals and grievances. Great. Okay. No, you've got to really sit down. Okay, we're going to need a team. How many people are we going to need? What does appeals and grievances, what kind of systems will they need to use? What are the requirements about appeals and grievances? That will start to dictate your resources that you're going to need. But the point is, you've got to understand what kind of policies and procedures are going to be needed for that particular state or that particular program. What will you, and how will one team interact with another? How will how will information flow within the organization to make things work? What will your compliance and privacy program be? What are your training requirements, for example? What are your recruitment requirements? What teams will you need to have in place? I know I worked with the state who said to me they did not need to have a specific fraud, waste, and abuse unit, an SIU unit. And actually, for their state, they were required to have a specific team to deal with fraud, waste, and abuse and audit fraud, waste, and abuse. So they really hadn't gotten to the bottom. They said, oh, well, we provide training. It's not going to be our role to, identify whether our providers are committing fraud, waste, and abuse. And I said, well, actually, as a matter of fact, yes, in your state, it is. So there's an element of really finding the tools and the resources. This is no small undertaking. It is huge. If you're going to get into the Medicaid space, it really does take people who are great analysts that can navigate their way around these contracts and these requirements. And there is an element, the truth is, I've been in so many states in my career, and the truth is there are some common elements. They all require HIPAA compliance. They all require some involvement, training, policies and procedures around fraud, waste, and abuse, and billing and credentialing. But the devil is in the details, as Lorie and Elvan often say, right? And that's where you get a lot of the differences in the minutiae. There are structural differences, but there are also differences in the minutiae of what those contracts require. And it's important to know if you're an organization first getting into Medicaid, or you're an organization who's trying to get into Medicaid across different states in the country, this is an important thing to understand. If Medicaid is a new program in every different state and you've got to go through this process, yes, to a certain extent, you can develop a playbook, but you have to understand that the structure of Medicaid is going to be different. There's going to be a learning curve in every single state. And you've got to be able to plan for that, understand that, build that into your metrics and your performance delivery. So Alva, now that I'm kind of hopping off my soapbox, what were you going to say?
Well, this is a completely different direction, but the theme around this conversation, the biggest theme of this conversation, what Lorie has shared, is how different it is at every state. How you need to have deep understanding, appreciation, and knowledge of application. So, pulling this in a completely different direction, what does that mean to somebody who is growing their professional acumen in this? How will you show up nowadays? Most jobs being remote, you don't have to. Some jobs, of course, do require you to be a state resident to work in that state. However, we do have plenty of compliance professionals who listen to this podcast and wondering, okay, I'm an expert in Pennsylvania. There's an amazing opportunity for me in Michigan. So, how do they prepare for that? How will you grow your acumen? How will you present yourself?
Ooh, that's a good question.
I know it's a
And
completely different direction, but we just have to cover it because part of our, we love this podcast for this reason is that to be able to say, okay, if I'm the listener and I'm really interested in this subject, I don't want to find myself stuck in one state when there's an amazing opportunity and a growth for me elsewhere.
no, you've raised a great point. I don't think it's actually totally off topic. And again, it's one of the lessons that Lorie first brought to my attention that for some Medicaid programs, and Lorie will speak to this in a lot more detail, I think she can answer it better. But my tiny contribution in answer to your question is actually there are some Medicaid programs that require certainly the compliance officer and some of the senior leadership of an organization to be living and from the state that they're actually serving in, which is a big deal. That's what I mean about, doing your prep work and analyzing something as very basic as who's going to lead the organization into this Medicaid space from the get-go needs, and organizations don't believe me when I tell them. So if you're in, let's pretend Utah, and you say, "Hey guys, no, you've got to have leadership living in Utah to participate in this Medicaid program," it can cause a real problem. It's an issue. Lorie, what have your experiences been there and trying to get to the heart of Elvan's question?
Yeah, so typically, I will speak for the states that I know. In general, they want you to be in the state where you're serving. They want you to understand that population of members because every state's population is a little different. Their needs are a little different. If you're working with a state where the population is much older, you have different concerns. Where if you've got a younger, healthier population that maybe has financial constraints, it's a very different thing. So again, I hate to say it, but I always go back to that base agreement. Look at your required roles, look at what's required. But if you don't reside in the state, let's say that you live in the next state over, but you live really close to the state line, sometimes you can approach the state regulator or regulatory team and ask for a waiver or an exemption so that you can serve in whatever role. Now, often I will say if it's a medical director of any type, whether that's physical, dental, vision, behavioral health, etc., they require you to be licensed, have licensure in that state. And sometimes some of the other rules will require state licensure. So, legal, for example, they want you to have licensure or the ability to practice law in that state. As always, I recommend going to that base agreement and seeing what your residency requirements are. But if you don't, let's say you live in state A, but you live right on the border with state B, or you know that you're frequently visiting in B, talk to your regulators or your regulatory team about an exemption or a waiver. You have to make sure you meet those basic requirements in that you're licensed or credentialed in the state. So, particularly around our medical directors or legal professionals, for obvious reasons and insurance liability reasons, they have to be legal to practice in whatever state. But I think if you're the compliance professional, most of our credentials are good across all the states and the territories, so you're not going to have as much of a problem. It's important that you know your population, regardless of where you live. And so I don't think not living in a state is a barrier, but there is perhaps a learning curve, but you always want to make sure that you're transparent with your regulators and your leadership and file for those waivers or exemption as they apply.
And I'd
Did
agree
that
with
answer
that.
your question, Elvin?
Yes, but I also want you to quickly touch on something else. It's very important. But what do we do about the professionals who are wanting, not just as a requirement, but how do you grow your career, your professional acumen, when the states differ so much from each other, and when you don't get to say, I know Medicaid? You can only say, I know Pennsylvania Medicaid. Does that make sense? How do we
Well,
grow that professional acumen?
I mean, this is what I think about generally compliance, right? It's your skills. So Lorie was talking about senior leadership, right? And running an organization and Medicaid requirements. But if you're a compliance professional and you're looking to get expertise in across different Medicaid programs, I don't really see that there's necessarily a huge barrier to your being able to do that. I think it's about the skill set that as compliance professionals we bring to the table, right? We know our way around regulatory organizations. We understand how to read and interpret regulations. We are analysts, right? We know how to pull data out. We know how to communicate requirements and break it down. We know how to gather evidence. We know how to research and learn about different state requirements. We know the language, the regulatory language. So to me, it's not always about knowing the specific Medicaid rules in a particular state. We've got 50 states. How can we? And there's Medicare and commercial insurance, and there's HIPAA, and there's interoperability, and there's, clinical standards, and there's all of this stuff. There's care coordination and all the rules, and it goes on and on and on. But the truth is, it's the skill set that allows us to do what we do. In my view, and Lorie may agree or disagree, is getting into other Medicaid spaces is the skill set that you have and that you bring to the table. And that's what you need to emphasize. Lorie, what do you think?
Yes. Even though every state will administer their program differently, Elvan, I think it's somewhat of a I'm trying to give some catchy phrase to it, but it's like a computer, right? When you build a computer, there's components that you put in, or there's parts that you'll take out. So if you know the general concept of how appeals and grievances work, even though another state may have different time frames or something like that.
And I'd add to that, I love the word universal, right? So you have things like HIPAA. We talked about this. Things like HIPAA, fraud, waste, and abuse. The general concepts are universal and have broader applications. So you can leverage that knowledge, understanding, as we talked about, that the minutia might be a little different. You need policies and procedures. You need an audit program. You need credentialing or staff recruitment if you're a provider. Like, the general concepts. It's the minutiae. But as compliance officers and compliance professionals, I think we're uniquely positioned actually to navigate these kinds of differences between programs. And that's the skill set that we develop and we hone and that we bring to the table. So I thought that was a brilliant
Yeah.
question.
Yeah, the other thing I would say is it goes back to the fundamentals, right? If you understand external quality review and the protocols that CMS has sent out, even though it's administered differently in the states and territories, ECRO is ECRO is ECRO. And if you understand those 10 required principles, you're going to be fine. And you can build and customize your knowledge across whatever state or territory you're working in.
And I'd say, if you've had exposure to audits in general, whether they're federal audits or state audits or even accreditation audits or even, county audits, like you've had some formal external
Mhm.
audit and review experience. That is
Mhm.
setting you up very well. Again, I'm going to the skill set
Mhm.
and building off of what Lorie just said. If you've had exposure to audits and responding to audits and working with regulators, then actually that helps you across Medicaid programs as well. You don't have to be, you just say, okay, well, this is a quality monitoring program or an audit program or whatever it is. If I can respond in one context, I can
Mhm.
respond successfully in another. Okay, what didn't we cover?
Absolutely.
Anything desperate we want our listeners to know that we haven't actually mentioned last minute?
Let me look at my
There's so
notes.
much to
Let me
talk
look at my
about, but
notes.
Well, while Lori's looking at her notes, what I do
there's
want
truly
to
so much to talk
say
about.
there is, and that can be a little bit overwhelming, even for us as speakers. And those, it's even worse, I think,
Mhm.
because we have so much experience in the field. It's very hard to really pick out an angle. You almost want to dump all of this information, and you can't. You want it to be sensible. But I guess what I'd say, and what interests the three of us, if I can speak on behalf of all three of us, is that truth, the Medicaid space, if you want to talk about it that way, is so dynamic and so interesting. It's actually exciting. Like, I don't really think you can get bored. There is so much. And that challenge of understanding Medicaid across different states, I'm not going to lie, sometimes it's frustrating. We have bad days as well where we're looking at our phone or our emails and going, really? Seriously? How many more hoops? Or how did I miss
Mhm.
that? Or we don't agree with this interpretation or the politics. It is such an interesting space. Medicaid, is governed. There's an element of politics. There's an element of federal and state politics and local demographics. And there's just so much going on as you start to dig into Medicaid programs across states. It's challenging, there's no doubt about it. But as so many of us go into this field because we like a challenge, right? We have such a diverse skill set, and we've always got to use that skill set all of the time. That Medicaid space can be a really
Mhm.
great place for a compliance professional to be. It is exciting. I know we joke about the difference and some of the frustrations, but we do compliance because we really love it, right? And we love different aspects of it. And working in the Medicaid space can offer you a real opportunity to develop your skills, to develop new skills, to understand some of the challenges around the country. It can give you insight that you never expected about the United States, about the healthcare space in general and localized, right? I know that Lorie and I once worked with Arkansas and the Medicaid program. We were standing up a Medicaid program in Arkansas. It taught me some life lessons, and it wasn't just about the Medicaid program. But in order to do our jobs effectively, we had to understand the political, the social, the demographics, all those different aspects of Arkansas. And it really tested us. And also, the way that we communicated was different, even with the staff. So, I mean, it really tested us, not just as compliance professionals, but as professionals and people at the same time. So, I guess I'm saying all of that to tell those of you who are listening, Medicaid can be a really exciting space. It's not for the faint hearted. I totally get that. But it's an amazing space to be in and can offer a lot in terms of professional development and experience and understanding the world around us. Anything to add to that?
I want to thank you both for giving Medicaid this platform. I think for me, it is something that over the years
It is a high note.
I I've become more passionate about, and it's such an important program that serves some of our most vulnerable neighbors in our communities. and it's so misunderstood. There's so many misconceptions that I'm just glad we could talk about it. So thank you.
Aw, you're lovely, and I do mean that. So with
Mhm.
that, the three of us set out today to
Yes,
give
we are
you a
blessed to have your
flavor.
knowledge, Lorie.
I know, it's true. She's taught me. It is Lorie that's, many years ago started me on this path to Medicaid, and I owe her for that. But on that note, right, what we set out to do today was give you a flavor of Medicaid and how different Medicaid can be from one state to another, some of the challenges, but also some of the rewards of working in the Medicaid space. If you're out there and you're, working in the Medicaid space or considering getting involved in the Medicaid space, remember, do your homework. We're more than happy to connect with you and walk you through. We may do another podcast on the Medicaid space and get to some of the concepts and issues that maybe we weren't able to cover in the time that we have today. But know that it's not you. It's very normal. And the trick is understanding Medicaid is different from one state to another. And you need to make sure that your leadership for your organization really understands that and gives sufficient resource to the planning and the research stage, right? So making sure you're going through those contracts, you're doing the analysis, and everybody has a good idea from the beginning of what Medicaid entails and the kind of effort that's going to be required and the timeline. I did have a client once, a health insurer, who said, "Oh, it'll just take 2 or 3 months, no problem." And I work with clients at the moment who think they can just submit a Medicaid application to a state, and a couple weeks later, they'll be a Medicaid provider with the state. And it really is that easy. And they built all of their performance metrics on getting into all 50 states in 1 year, boom, 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 with just one person helping them get into the enrollment process. So there is a lot of misconception. So think about some of those ideas, some of those concepts. The three of us are always here. You can get in touch with us via LinkedIn, via my website. You can leave comments if you have questions about Medicaid. We're more than happy to act as colleagues in arms, right? And on that note, we will call it a day. Thank you, everyone, for listening. Hope you enjoyed the podcast and were able to take something away
Thank
that
you.
you didn't know before. See you next time.